Amyloidosis is a disorder where misfolded proteins form insoluble fibril aggregates called amyloid. These deposits can accumulate in organs, causing dysfunction. In this lecture series, we'll explore amyloidosis in detail, from classification to treatment, enabling a comprehensive understanding of its clinical implications. Amyloidosis is a disorder caused by the accumulation of abnormal protein fibrils outside cells, causing damage to tissues. It can be categorized into different types based on the protein involved. We will explore the clinical presentations, affected organs, and protein abnormalities associated with each type. We will also discuss the characteristic features seen under the microscope and the role of enzymes in forming these abnormal protein fibrils. Amyloidosis arises from the misfolding and aggregation of normally soluble proteins, leading to their conversion into insoluble fibrillar structures. We will explore the molecular mechanisms that drive this process, including conformational changes, protein-protein interactions, and the influence of the cellular environment. Moreover, we will discuss the role of chaperone proteins, such as heat shock proteins, in the prevention and clearance of misfolded proteins. A detailed understanding of these mechanisms will provide insights into targeted therapeutic interventions for amyloidosis. In this section, we will explore the different types of amyloidosis, including primary, secondary, familial, and localized. We will discuss the specific precursor proteins, clinical features, affected organs, and prognosis associated with each type. Understanding these distinctions is crucial for accurate diagnosis and patient care. Renal amyloidosis, affecting the kidneys, presence with proteinuria, nephrotic syndrome, and renal insufficiency. Diagnosis involves renal biopsy and genetic testing. Treatment options, including chemotherapy and targeted interventions, focus on preserving kidney function and enhancing patient outcomes. Cardiac involvement in amyloidosis can have devastating consequences, often resulting in heart failure and arrhythmias. We will examine the various forms of cardiac amyloidosis, including AL and transthyretin, ATTR, amyloidosis, highlighting the clinical features, electrocardiographic changes, and echocardiographic findings. Furthermore, we will discuss the emerging role of cardiac magnetic resonance imaging, MRI, and nuclear imaging techniques in diagnosis and monitoring disease progression. Finally, we will explore the current and evolving treatment options, such as novel gene silencing therapies, targeting the underlying amyloidogenic protein. Familial amyloidosis represents a subset of amyloidosis cases that are inherited in an autosomal dominant manner. We will investigate the specific genetic mutations linked to familial amyloidosis, such as mutations in transthyretin, TTR, apolipoprotein AI, APOA-I, and gelsolin, GSN. Moreover, we will explore the clinical heterogeneity and organ-specific manifestations seen in familial amyloidosis, underscoring the significance of genetic counseling and screening for at-risk individuals. Amyloid deposition in the central and peripheral nervous systems can lead to a wide spectrum of neurological manifestations. We will discuss the clinical features of amyloid-related neuropathy, including peripheral neuropathy, autonomic dysfunction, and carpal tunnel syndrome. Additionally, we will explore the role of neuroimaging techniques, such as MRI and positron emission tomography, PET, in diagnosing and monitoring disease progression. Lastly, we will examine the evolving therapeutic strategies targeting the neural manifestations of amyloidosis. The diagnosis of amyloidosis can be difficult due to its nonspecific symptoms and the requirement of invasive procedures for confirmation. Emerging biomarkers and advanced laboratory techniques, such as mass spectrometry and imaging, are aiding in the diagnosis and monitoring of the disease. The treatment of amyloidosis aims to reduce amyloid precursor protein levels, inhibit fibril formation, and promote amyloid clearance. We will evaluate the role of chemotherapy agents, such as bortezomib and melphalan, in targeting plasma cell dyscrasias in AL amyloidosis. Stem cell transplantation, including autologous and allogeneic approaches, will be discussed as potential curative options for eligible patients. Additionally, we will explore organ-specific interventions, such as liver transplantation for transthyretin amyloidosis, and the emerging role of novel targeted therapies in clinical trials. Non-invasive imaging techniques play a crucial role in the assessment of amyloidosis, particularly in cardiac involvement. We will discuss the utility of echocardiography, cardiac MRI, and nuclear imaging, such as technetium-99 pyrophosphate, carat-99 MTC-PIP, scanning and fluorine-18, carat-18F, amyloid PET, in the diagnosis and monitoring of amyloid cardiomyopathy. Additionally, we will examine the prognostic significance of imaging findings, such as extracellular volume fraction and global longitudinal strain, in predicting disease progression and clinical outcomes. Organ transplantation, such as renal or heart transplantation, is considered in select patients with end-stage organ failure secondary to amyloidosis. We will explore the challenges and risks associated with transplantation in amyloidosis, including the impact of amyloid deposition on allograft survival and the potential recurrence of amyloidosis in transplanted organs. Additionally, we will discuss the role of combined organ transplantation and the emerging field of preemptive transplantation to optimize outcomes in eligible patients. Several conditions, such as monoclonal gammopathy of undetermined significance, MGUS, monoclonal gammopathy-associated neuropathy, and light chain deposition disease, can present with clinical features resembling amyloidosis. We will evaluate the key differentiating factors and diagnostic approaches that aid in distinguishing these entities from true amyloidosis. This knowledge will enable clinicians to accurately diagnose and initiate appropriate management strategies for patients presenting with similar clinical presentations. Amyloidosis describes a group of disorders where abnormal proteins accumulate in organs, causing dysfunction. The lecture delved into its definition, classification, mechanisms, clinical signs, challenges in diagnosis, treatments, and ongoing research. This knowledge will aid in effectively identifying, diagnosing, and managing patients with amyloidosis, enhancing their well-being.